Oh. That's okay. And now we're going to sit down again. Now hold on. That bothers me that you reach back that way. I'd like you rather to hold on this way. And we'll sit down again.
Feel for the bend?
Yep, and just bend forward. That's it.
With contact at the shoulder and at the hips, I help Lauren to come forward and sit down symmetrically and with control.
Top or shoes and socks?
Top.
Top, okay. And get your top. And what I usually do is we have to put the weak hand in first. And we're going to set this up. So this sleeve is down between your knees. Okay? Like that. And take your arm and place it down in the sleeve and then lean as far.
By leaning forward to put her hand in her sleeve, Lauren inhibits lower extremity extensor tone, and at the same time, scapular protraction also inhibits upper extremity flexor tone.
Good. And now you can do the other sleeve. And you need to get this up over your elbow. There. Okay.
Help your patient maintain forward flexion as they pull their shirt up over their head.
Great. Good. Socks?
I help Lauren to use her left hand as an assist when crossing her leg and putting on her brace and her shoe. I help to cue her forward as she uses excessive trunk extension.
Now some people like to put the shoe on. Some people prefer putting the shoe on the floor and putting it on that way.
Since her stroke 2 years ago, Lauren has worn only tennis shoes with Velcro closures. Today she was delighted to learn one-handed shoe tying.
So the first thing, when you're going to do one-handed shoe tying, I need to relace it because that'll get it started. And so what I always do is I do this for the person. I don't expect you to do this part one-handed. So what I do...
Here's how I had shown Lauren to do this earlier in the day. This is how you can show your patients this very simple method.
And then what I do, so it's out. And then what I do is I take the end of the shoelace and I just put a simple knot, just an overhand, just a regular little knot right on the end of it. Okay? The knot I'm going to put on the outside instead of the inside. I used to put it on the inside and I wore my shoes this way just to see, and it's sore, it pushes. So instead I'm going to put the knot on the outside. Oops. When I go across to the hole on the same level, across the way, I'm going to go from the top down through. What's nice about this is every time you go down to the next level, you're going from underneath up through, and every time you're going across the way, you go from the top. So when you're going to cinch up your shoes and tighten them up, it makes it really easy to do. Plus it looks kind of nice. It doesn't look really odd.
Just a quick point about tennis shoes. Patients who lack dorsiflexion often do much better with leather-soled shoes rather than tennis shoes. The stickiness of rubber soles on carpeting can hinder swing phase and worsen abnormal gait patterns. Also, older patients who have never worn tennis shoes in their life can find walking in them difficult. And because tennis shoes are designed to absorb impact, if they have any sensory loss, they often have difficulty feeling when their foot hits the floor during heel strike.
Okay, now, do you see how that works? Now the other trick to really keep your shoes on the whole day is after you've gone through all of the different holes. I've come through this last hole, that was the last hole I went through. I'm going to go across the way to the hole on the other side and go up through that a second time. Now it's ready to give to you. And so I would get your shoes ready like that. Then this one. Then this one.
Learning one-handed shoe tying gives patients the option of wearing any number of shoes in their closet.
Good. And then you'll make the letter C. That's it. You got it. Yep. That's right. And then cinch it over. That's it. So what we're going to do is get you undressed first, huh? So can you take your shirt off?
When undressing, begin with the strong side. Notice again how I am on Dale's involved side as I assist him taking off a button-up shirt.
It's a little tight for you. Now let me show you something. When you take the shirt off, if you lean forward so your arm is hanging down a little bit, and take this hand and take it off. It just is a little bit easier that way. And stay forward. And instead of pulling your arm back, just slide your shirt all the way off like that.
Okay.
And then your hand doesn't get so tight that way. Do you see what I mean?
Okay.
Good. Now what I usually do is I just have people make sure that it's loose here and just not your sleeve so much as here. There you go. And on this side, because sometimes it's still tucked in and it's hard. And then from here, reach back and lean forward and take your shirt off. There you go.
A pullover is a little bit different, as we can see with Lauren.
Forward like that. You can take your strong arm out.
Use my teeth a lot.
Or rub against your pants. That's good. Now from here, what I'm going to have you do is reach like this and staying forward without pulling up. Have you take your hand out like that. Now we need to take off your shoes and socks. So we can cross your leg over. Now see how you do that? Look how you lean way, way, way back. See if you can just stay forward a little bit while you bring, you don't have to come real far forward. Okay.
As Lauren takes off her shoes and socks, I discourage abnormal patterns of movement and stabilize her left leg to help give her a better base of support. Her hand is positioned forward, either resting on her leg or down to her side. Don't allow your patient's arm to become trapped in their lap. This could cause pain and impingement at the shoulder. Remember that during self-care activities, I'm looking at how they are moving. Here are some examples of problems that came up and just how I corrected each one of them.
Remember, when we stand up, we've got to have your feet back a little bit. And I usually look to make them even with the other side. Now hold on and I'll help you. Okay.
Hold like this.
Do you remember? Yeah, if you put your thumb in there and bring your fingers around your wrist, that's great. And I'm going to help you lean forward and stand up. Let's do that again. Let's practice that. Let's sit down. Lean forward. Okay. I'll do that again. Okay. So, how I want you to have your hands, let go for just a second. You can have your hands just on your legs like this. That doesn't bother me if you want to do it that way. And that's comfortable for you, it's okay.